We're here today with Will, and Will has a little problem. Do you want to tell us what your little problem is?
Yeah, I've got some lines on my. It's from sleep. I've just got some lines that are coming down, and
Are they more prominent on this side here? You can see this. You can see they kind of stick around.
yeah, and I have one on this side as well. I'm not sure.
Okay.
But it's.
And how do you do with Botox?
What do you mean?
Does it work well for you?
Yeah.
Yeah, okay. But even with the Botox, it doesn't make these go away. So what we're gonna do is we're gonna do a little bit of filler, and my favorite filler is gonna be Restylane Refine. Restylane Refine is a very elastic product, which means it's very cohesive, it sticks together. And the other thing is this is a small particle, because we don't want a big particle here. Now, I've done a lot of fillers in the forehead, and it's easy to do them in the glabellar creases. These are these creases, the 11s, if you wanna call them that. And you don't have any problems with those. The one thing you have to worry about is injecting in this area is blindness, but I've been doing this for a long time, so I feel very comfortable doing the glabellar creases because the vessels are very deep, and so as long as you stay superficial, you're fine. Now the foreheads are a little bit different though, because with the glabellar creases, you really want to pump a bunch of filler in there to try to get it to plump up and disappear. However, with these, what I found is doing these for years and years and years, I found that you have to do a very, very minimal amount and sort of undercorrect so it looks natural. Perfect, perfect. You can see there's a pretty deep one here. And with injection, there are lots of different injection techniques. But for this, I like to do a threading. I just like to put it very superficially underneath that line that he has. I want to make sure I'm in the right place. And then I'm just going to gently push a little bit of product.
Okay.
Now,
Can you tell me why you're doing
a lot of people think I'm bending the needle in the skin, and I'm not. I'm bending it before I go in because that way I can stay parallel to the skin surface. And again, I'm putting just very, very few drops because I don't want this to swell up and leave like a snake or worm, gummy worm of product underneath the skin that you can see. Again, we're getting just a little bit of filler there. And just very little bit. And I'm going to go back because I'm not seeing the complete correction like I'd like to. So I'm going to try to go a little more superficial. And again, I just put in little drops, and I'd rather go back in a week after the swelling goes down and add a little bit more. There we go. Better, but not gone.
Is this a common procedure to inject the forehead?
It's a procedure that I do not infrequently. It's not something I do every day, all day, but it is a procedure that people will like, especially people that have had Botox and their wrinkles are not going away. Because if you keep making the same expression over and over and over and over again, what ends up happening is the wrinkle turns into almost scar tissue, and there's histological or evidence under a microscope that they look more like a scar than they actually do a wrinkle. So they just are harder to manage. Did that answer the question? I got really caught up in what I was doing there.
Yes.
You can see these are disappearing right here, and they look great. That looks really good. So this side we're having good success with. This is the side he doesn't sleep on though, and so that's why this one's easier to manage than the other side. Will said he tries to not sleep on that side, but are you successful?
No.
I have to agree with you. I tried sleeping on my back years ago when I realized that I was getting wrinkles from my sleep habits. But I just can't sleep on my back.
Me either.
How long does it take to develop wrinkles?
Wrinkles start pretty young. I mean, my daughter, she's 17 and she's got wrinkles. I'm making her get Botox now as a preventative measure. I am a good dad, though. I'm not letting her get fillers yet, so except in her nose. Okay, and you can see we've got this to look better. And we've only used a very teeny little bit of the filler, so in a couple weeks we're going to have him back and do a couple finishing touches. The thing that's interesting is he turned very red from this treatment. Look at that. He turned super bright red, and that's a little bit unusual. So that is how we put in filler into forehead wrinkles. And so if you're a person who has prominent forehead wrinkles and it's not responding to Botox, this is something we may want to add in addition. So thank you for tuning in. We always appreciate you watching our videos on fillers and other cosmetic procedures. This is one of my favorite things to do. So I just love facial fillers and the effects that they can do. It really makes a huge difference in your life, and it makes you feel more confident and more beautiful. So if you have any questions, please let us know, and thank you for tuning in to our Facebook, YouTube, Instagram, and TikTok channel.